Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with us today is Dr. Ayman Hassan. He is a neurologist at Thunder Bay Regional Health Science Center. Brain plays very important part in our body, in communication, in speech, and in movements. And right side of our brain controls the left side of the body, and left side of the brain controls the right side of the body. The functional unit of the brain, which is called as neuron, needs continuous supply of blood and nutrients to keep it functioning. And supply to the brain is by arteries, which are called as cerebral arteries, which supply blood to the brain. Now, when there is a disruption in the supply to the brain, then it results in a condition which is called as stroke. About 742,000 patients in Canada at this time are diagnosed with stroke, and about half of them are men and half of them are women. And the patients who are diagnosed with a stroke, about 25% of them are less than 65 years of age. The risk of stroke increases after the age of 55. Very few patients or people know that they are at risk for the stroke. And to make us aware today about what are the risk factors for the stroke, what are the conditions which can cause the stroke, how stroke can be diagnosed at early stage, what are the treatment options, and what is the prognosis, we have Dr. Hassan with us today. Thank you, Dr. Hassan, for coming today for the Talk with Doc show.
Thank you for having me.
Please tell us in your day-to-day practice how many patients you see with the stroke. What is the incidence according to your practice?
Actually, in Thunder Bay Regional, we have the regional stroke unit, and we admit yearly 400 plus, somewhere like more than 450 actually patient a year with a stroke. In the stroke prevention clinic, we see about another 700 plus patient with a stroke. Some of them are those who discharged from the hospital, so maybe we are counting them twice, but on average we have like over 1,000 patients with mini stroke or a TIA or a completed stroke per year in the Northwest.
That's a huge number.
Mm-hmm.
So what is stroke? Can you please explain us?
Sure. So stroke is interruption of the blood supply which happens suddenly, either secondary to a clot that block one of the arteries, leading to what we call ischemic stroke, which is secondary to lack of blood supply in 85% of cases. And in 15% of cases, it may be because of a bleeding, rupture of one of the small arteries, leading to bleeding in the brain that give the same symptoms of sudden focal neurological deficit.
So it can be due to blockage of the blood vessel or the hemorrhage in the brain.
Correct.
Which is the most common type?
The clot,
Clot
about
formation.
85%.
85%
Yes,
is due to the block.
Mm-hmm.
So what happens when there is a blockage? What are the signs and symptoms?
It depends on the part of the brain. The most common symptoms of a stroke would be what we promote in the acronym FAST, F-A-S-T. The F stands for the face, so if there is any facial droop, and the A stands for arm weakness, so the patient try to lift the arms, or this is true for the legs too, so any of the extremity weakness, or S for speech, and if they have any trouble understanding or expressing themselves or having slurred speech. And the T stands for the time, which is the time to call 911, which I think we'll talk about this later.
So F-A-S-T, so facial abnormalities, right?
Facial droop.
Facial abnormalities, facial droop. So what happens exactly? Can you please explain us a little bit?
So the patient would have some kind of weakness. So either the patient himself or someone would notice that the face is droopy on one side, and that when he looks to himself or herself in the mirror, they see that they can move one side but not the other side of the face. And this facial droop could be a sign of a stroke. It could be as part of other weakness like arm and leg weakness, or it could be by itself with some slurred speech or trouble finding words.
So a facial abnormality, is it noticeable, or it can be very mild and may not be?
It could be sometimes very mild too.
Right. So patients who have the limb abnormality sometimes, or gait abnormalities, and we have known that patients with the stroke, they don't know about their own abnormality, but somebody else notices it.
This is true for certain types of a stroke, Like when they have the aphasia, they don't understand or they don't realize that they have the speech problem sometimes when they have the fluent type of aphasia, which is a speech abnormality coming from the posterior part of the head. They are able to talk, but they don't make sense.
Okay.
And sometimes they keep repeating themselves. They are not aware that they are having a problem. And usually the people notice this. Or when they have like a mild facial droop or a bit of mild slurring, and only people who are good observant or who are knew them for quite some time, they can understand that there is something wrong going on with them.
So is that the earlier stage of the stroke being developed completely, or?
Like sometimes the stroke develop right from the beginning, so everything happened at the same time, and sometimes it may develop over a few like minutes, but or sometimes even longer. But most of the time it is a sudden interruption of the blood supply.
Right. So now, how important it is for us to diagnose this symptom at early stage?
So there is a time window which is 4.5 hours, where if this is an ischemic stroke, which is secondary to a clot, and this is true in 85% of cases, and the patient presents with a significant neurological deficit to the hospital within the first 3.5 hours, we can still give him the medication, which is the clot buster. It's important because every minute of delay means loss of 1.9 million neurons and 1.8 billion synapses and 12 kilometers of axons. Actually, the brain loses as many neurons as it does in 3.6 years of aging if the medication or the treatment for stroke is delayed in the hyperacute stage is delayed by an hour.
Wow, so every minute counts there.
Yes.
Because every minute you lose billions of neurons probably then.
1.9 million and billions of synapses and axons and everything that connect the brain.
So it is very important to know about these signs and symptoms, which is FAST.
Yes.
And what should one do once somebody sees somebody having these symptoms?
Call 911. This is the most important thing.
Call 911.
Yes, people in northwestern Ontario actually are the least to use or to access 911 services in Ontario, and this is from statistics. Only 49% of the people would call 911. The paramedics are very well trained to exactly know the stroke symptoms and signs, and they can deal with early problems at the time. They can also, they know every and each hospital which are equipped to treat those patients. So if they are in a region where the hospital do not have a CT scan and they cannot treat the stroke patient, or they don't have in our region what we call telestroke site, where the medication or the clot buster can be given through connection via telemedicine or telehealth with someone in Ontario who a neurologist or a strokeologist who can help them to give the medication TPA before they being transferred to Thunder Bay Regional for the regional stroke unit. They know where to shift the patient, so the paramedics are very well trained to do this, and there is a bypass agreement where they can go from one place to the other to bring the patient to the hospital that is best for management of his stroke.
So calling 911 is the key thing here.
Yes.
Yeah. Thank you, Dr. Ayman. We'll take a short break and we'll come back. Please stay back. Thank you.